Okay, this is Dr. Richard Barwell, and we're talking about neurologically based chiropractic, and we're interviewing people in our BrainTrust group. And I'm excited today, as usual. We have Dr. Ted Arkfeld on today, and I really want to have a chat with you. I want to salute you for your incredible performance at the Florida Chiropractic Conference's CE program last week or weekend before. Fantastic stuff. I didn't get a chance to get in and hear you because they had me talking at the same time. So I kind of missed what you were saying, but I got great reports on it. Great reports.
Oh, good.
So let's sort of find out a little bit about you and your background. Where was your education from and how long you've been in practice? And you're doing something else besides practice. So.
Well, actually, April of this year will mark my 30th year in practice.
Wow.
And I graduated in 1988 from Northwestern College of Chiropractic up in Bloomington, Minnesota. And so immediately after practice, or after graduation, I headed down to Phoenix, Arizona, and set up practice down there, where I gravitated towards the personal injury and more acute type of trauma injuries, and did that for about 13 years. And then relocated up here to northern Michigan to a little tourist town in 2001, and kind of switched gears, got into chronic pain management. For about 10 years, I practiced in multidisciplinary setting with MDs and PTs and PAs and nurse family practitioners, and which was exciting, but you know, it was also kind of frustrating because I saw a lot of patients that should have saw chiropractic first, and they had gone through all this gamut of epidurals and all this medication, and you know, now it's all coming to light with opioids. But you know, we were seeing this back in 2004, this issue. So, and then you know, in 2007, after about 19 years in practice, I was burned out. I was just kind of fatigued and burned out, and I took 2 years off and went into a whole different industry. I became a certified professional coder and got into compliance consulting. And that started right when the MPI number came out and post-payment audits came out, and so I did that, and I've done that up until really just a couple of weeks ago, and I put my compliance consulting to rest, and I'm back in full-time practice now and loving every minute of it.
Wow. And there's been a shift because, well, you graduated from Northwest when there was still some chiropractic influence going on. I don't know how much of that, but there was still some compared to sort of what's going on now with most of the colleges. So you came out with sort of the standardized structural model of chiropractic?
Yeah, you know, Northwestern was more clinically oriented, not so much on the philosophical. Obviously, we were taught subluxation complex. I can tell you that I learned very quickly when doing insurance reimbursements in Arizona not to put a subluxation on a claim form, because we would not get reimbursed as well. and you know, and quite honestly, in the back of my mind, I always thought that there was more to subluxation, and I know you've heard this so many times, but I always thought there was more. But yet, like everybody else, I would sit there and put my finger in the IVF and twist the bone when doing a report of findings until the patient sees, you know, there's pressure on that nerve. And, you know, and I always kind of thought there was more, but I didn't really know where to look or what I was really talking about on what more was.
Yeah, that's the standard sort of thing that happens. They you know, we had our philosophy. It came out with the bone-on nerve stuff. That's what we were all taught. We all did that. But then when the challenges started coming along about that, they never offered anything else. They just sort of left us going, well, if it isn't that, what the heck are we doing? So we end up with the doubts. How did those doubts play?
And you know, I thought I bridged the gap a little bit. I became a Cox certified doctor, and you know, I saw that, you know, the disc and the facet and the dorsal root ganglion. So that part that I thought was being pinched was really a compressed DRG. But, it didn't explain these other things that I was seeing with, especially with chronic pain patients. It didn't explain the anxiety, the depression, the insomnia. And that's what I just kept searching and searching. And at times it was very frustrating because I didn't feel like I was doing all that I could for the patients.
Yeah, that's the biggest challenge I think that a lot of us have. We know that there's something else going on. We don't know where to go to find it. And I know that's what drove me to where I am today and the approaches with it. So where did you first hear about this concepts of neurologically based chiropractic and looking at a higher level?
Well, I think my journey was a little bit different than most doctors because I was doing compliance consulting full time. Actually, the first introduction into anything neurologically was when back in 2015, I was down speaking again at a Florida chiropractic conference event, and I met Dr. Danny Porcello, who is a rock tape doctor. And I really didn't know anything about kinesio tape, and Danny was gracious enough to spend about an hour with me and describe what rock tape does and all the applications. And a couple weeks later, I was sitting in a certification course in Columbus, Ohio. What was amazing, and I didn't realize it back then, but that was the start of this journey. When you put the rock tape on, you're actually firing up thousands of sensory skin receptors that are going to the brain. And that really was the introduction. And when it really came around was in 2016, again, at a Florida chiropractic conference event. I was to lecture, I think, from like 2 to 5, and Dr. Porter was lecturing from 10 to 12. And he was talking about traumatic brain injuries. And I thought, wow, I'm going to sit in on this. And he started talking about concussions, and he started talking about brain stress, and he started bringing up these things called beta waves and delta waves and theta waves and anxiety and insomnia. And I was just captivated by it. And I came away from there, and I did try the brain tap, and I was mentally exhausted. I had been traveling across the country lecturing on ICD-10, and I was just done. I was just tired of talking about coding, hadn't been sleeping well, and the brain tap really helped me to get my life back in order, get my health back in order. And so we started looking at this, and I thought, I'm going to get the location license. So I actually purchased the location license of BrainTap, and we started to implement it in our practice. Now, I need to back up a little bit. The practice was a very small practice. I opened up in 2009, and it was really as I use it kind of as a laboratory for documentation and coding, to see what we could do to really help doctors increase their reimbursements in an ethical and compliant manner. I was seeing about 25 patients a week, Monday, Wednesday, and Friday. I didn't do anything to build the practice. It was really full-time compliance consulting. I just still liked treating patients. But after meeting Dr. Porter and listening to that and bringing BrainTap on, I thought, I've got to start doing more. This really was, at the time, was the missing link. So we implemented BrainTap, but then I got to thinking, I've got a treatment, but then I had a patient ask me, I know you know I'm stressed, but how stressed am I? And I didn't know the answer because I didn't have the diagnostic part of it. That's what brought me to NeuroInfiniti. So I believe that I saw the NeuroInfiniti through BrainTap, and then I went to your website and I started researching it. It didn't take long. I mean, I was a pretty easy sell. And I think it was within a matter of 30 days or so, I had purchased the NeuroInfiniti, and I think it was about August of 2016.
And how's that been going for you?
Well, at first, it was a little difficult to implement in, and that was my own fault because we still haven't been to a training. So it's nothing with you guys. That was just my own fault, and I was still trying to serve two masters with the consulting and the practice. But we had a few phone calls with Dee Dee. I had calls with you, and I just realized this is what we've got to do. I had been very concerned about the profession, and that we are neuromusculoskeletal specialists, but we had forgot the neural part.
Yeah.
And I'd been seeing this trend in the files that I'd reviewed and everything over the years. I saw us really getting pigeonholed into musculoskeletal, and I didn't like that. We do very well with musculoskeletal. We do very well with treating peripheral nervous system, but we forgot about the autonomic nervous system. And it was like a reawakening. So in October of last year, 2017, I made a commitment. I said, we're absolutely moving to neurologically based. That means we have got to move out of our current location, and I'm going to stop doing consulting. I'm going full-time into practice. And so between Christmas and New Year this year, we moved into our new building, 2,600 square feet, one room that's just dedicated called the relaxation room. We have another, our exam room has the NeuroInfiniti, and that is part of our new patient exam process.
Fantastic. We'll get you to a training somewhere down the way and really turn you loose. I'm amazed at how well you have done. And, it says something about what we can do, even for those people that don't get to a training or can't get to a training right away. We can get you up and running and operating with this, and so you can start to understand what's going on. I'm wondering what's going on in your mind now that you all of a sudden have elevated from spinal challenges, the nerve root pressure challenges, and you're moving from the autonomic nervous system all the way up. Now we're looking as far as the cortex and in the higher levels of brain function. What's that doing in your head?
Well, I'm like a puppy again. I'm a chiropractic puppy. I'm having more fun in practice than probably I've ever had. I have a clearer sense of what I want to do and what I want to accomplish. My philosophical outlook is absolutely spot on because I see right now why chiropractic is so desperately needed in our society. And you look at the anti-anxiety medications. I've never seen so many patients coming in on such levels in 30 years of practice. But this is really more. I always knew the adjustment did more, and this explains it. We're lighting up the brain now when we do our manipulations, and that just expands our whole patient population that we now can see and the conditions we can treat. And if chiropractic is really honest with one another and with itself, the subluxation model, and I'm probably going to be accused of being blasphemous here, but we're still only seeing about 8 to 10% of the population. So this patient education model of subluxation has not worked. The neurologically based chiropractic does work. Patients resonate with it and they get it.
It's very strong this way. I was just interested, you said the philosophy. A lot of people see this as a challenge. The minute you start talking away from vertebral subluxation, chiropractors go crazy. But you said your philosophy is intact.
Yeah, it's stronger than ever. I used to be rather envious of some of the doctors that I would meet that maybe graduated from Life or Palmer because they had such a strong philosophical outlook on practice, and I just never was there. I mean, I always knew chiropractic care worked, but I just didn't have that real strong sense of purpose, and I have that now. And it's because we are needed in society so much nowadays. I see it with our kids. I happen to be a team chiropractor for our football and basketball teams at our local high school. So when you talk about neural performance and neurologically based, well, shouldn't that be the goal for our patients, that we are lighting up their brains, and that, our kids nowadays they're so stressed out. They are anxious about where they're going to go to school, what's on social media. It's not about who they're going to take out on Friday night anymore, who's sitting at the lunch table with them. They have so many stressors. We've got to address that, and medication is not going to address that.
How do you take this and introduce this to your new patients that comes in, people that are still coming in with the traditional concept of chiropractic, and you're shifting them to neurological? What's your first step in the office?
Well, it's really pretty easy. We bring up the discussion of causation. And I think that that is really missing in a lot of our discussions in chiropractic and really in the world today. What is the cause of everything? And we've got the nice little laminated sheet that you provided, and we talk about over-aroused, under-aroused, and all the symptoms. And you know what's really pretty cool is that even the patient that comes in, the disc patient that has herniated the disc or has a disc problem, you know, they'll say, well, what did I do? I said, well, this started years ago, and tell me about your lifestyle. Tell me, are you getting enough sleep? Tell me, are you anxious? Are you depressed? Are you having chemical stressors, physical stressors, and mental stressors? And they'll tell me all those, and there's always mental stressors. And I'll say, you know what? Here's what's happened. Your sympathetic nervous system kicked in so hard that it has actually decreased blood supply to the delicate nerve tissue and to your disc tissue, and it set the stage for degeneration, and ultimately that structure failed because of the stresses placed upon it. So this all ties back. Neurologically, what we do is all neurologically, and it's all the causation aspect. So the communication and the conversation is very easy with the patient.
It's just amazing how hard and how difficult a lot of chiropractors try to make this when it really is very simple. I love what Dr. Hoffman says. Before in this, Dr. Hoffman loves the question of, where do you carry your stress? You know, some guy comes in with low back pain because he lifted something. Guess what? You overstressed the area. It shouldn't have done that. It should have been able to handle what you did, but it couldn't because something wasn't working right. So it's these people that are struggling with how to know how to communicate this. I can talk about bone on nerve. You talk about bone on nerve because you learned how to talk about bone on nerve. You can learn how to do it in a different way. And obviously it's working for you. So you haven't gotten to the point of being able to do neurofeedback or biofeedback yet in the office, I think, because of the training?
No, we have. Dee has been wonderful. We implemented biofeedback and neurofeedback. As a matter of fact, I got a patient right now that's in receiving neurofeedback. We had a young high school kid that suddenly started having high blood pressure and wasn't sleeping well. And so we came in and did a stress response evaluation on him, and, you know, very beta wave dominant and very sympathetic dominant. So we got him doing biofeedback. We do the adjustment first, biofeedback, and then we end with brain tap. And we've been about 2 weeks now, and he says he's starting to sleep pretty good through the night, and, you know, lo and behold, the blood pressure is starting to come down.
Fantastic. It just, those things together with the NeuroInfiniti, the more than two, the chiropractic adjustment, and then the brain tap after are for programming, along with biofeedback and neurofeedback. I mean, that's as good as it gets for patients. You're changing brain function at a very high level, and you're making permanent changes to the better.
And that's exciting. You know, I really have two types of patients coming in right now. We have our typical musculoskeletal, and we have our athletic injuries, but word is spreading very quickly that we're seeing these other types of patients, these stressed out patients that just don't have anywhere to go, and they're coming to us as a last resort. And I can tell you, you know, I said we were seeing about 25 patients per week. When we moved in here, we are now averaging 80 to 90 patients per week, and we'll probably hit 100 this week. And we're gonna, and new patients are just coming out of the wood. We're not doing any advertising. You know, it's just all word of mouth. And so no matter what you call it, the universe, innate, divine, you know, intervention, I firmly believe that I was led to get into neurologically based chiropractic. And this building that I'm in now, it was right next door to my old building. I sat there and looked at this building every day through my other office. And when we came and looked at it in October, we didn't have to do any renovations at all. We just had to do some paint, and it was fully ready for us. Right. And we're off and running now.
What about retention?
Retention is through the roof. Okay. I got to be honest, I never really paid much to PVA, but we're at 35 or 40 now, and that's going to even go up. Yeah. Yeah. And you know what's nice? What's really nice is that we're not going to get on this new patient merry-go-round anymore. It used to be we get patients well very quickly, and then you get them released from active care, and we'd offer maintenance care, which we're not calling it maintenance care anymore. We're now calling it our neural performance program.
Oh, wow.
But we don't have to get on that new patient merry-go-round. We're keeping them. They're staying, and they're coming in. So after I get them out of pain, then we move them, as you always say, from pain to brain. And then, you know, we start addressing other causations, other things in their life, and it's been phenomenal.
You know, the minute you change the intent, you change the outcome. And that's a prime example of exactly what's happened in this office. And people think it's only one layer, but when you change the intent, it changes all sorts of layers down the road, such as people coming in, and you said it's the neural performance program. Is that what you called it?
Yeah.
I like that. That's very sharp. You know, peak performance is what I called it, but that's even better.
Yeah, so like with our young athletes, we're looking to make some major changes with our young athletes to make sure that they perform better. They're not out there worried about making a mistake. We're going to prepare them physically, mentally, and they're going to be ready to go. And, you know, parents are buying in, the kids are buying in, they love what we're doing, and it's really exciting. We had a young man that played on the football team last year. We used to do an adjustment and brain tap every Friday before the game. And he would go out, and he was all conference. He had unbelievable games, unbelievable season, and was an all conference performer.
I hate to reduce this down to a monetary level, but obviously we have to talk about this as well, because that's what people are sort of motivated with these days. Even though that was never my goal in practice, it was always about offering a quality of care. Obviously, you're seeing more people and you're sticking around longer. There's been a change in your bottom line.
Absolutely. We tripled the income. Now, we offer a lot of different types of therapies here, but they're all cash. The NeuroInfiniti's cash, BrainTap's cash. And we use a program called Chiro Health USA, and our practice right now is 2/3 cash and 1/3 insurance reimbursement. And so patients love it. They get the care they need. I love it because I don't have to worry about medical necessity or visit limits. I give the patient what they need, and so yeah, the income level is coming up. But you know, Dr. Barwell, that's a byproduct, an absolute byproduct of it.
Yeah. If you give people what they want, you'll get what you want.
Oh, absolutely. And you know, I realize the NeuroInfiniti, it's an investment. It's a business decision, really, when it comes down to it. But I can't see ever practicing without it again. And if you're on the bubble to do this, get off the bubble and do it. But you can't go half-hearted. You've got to be committed to this and committed to really start making a change in your patients' lives.
I appreciate that so much. This is it's been a long battle on my part, and it just warms my heart to hear you talking like this and seeing you enjoying success of making that transition. We need to hear more from you, and I'm so glad. We'll see you in Fort Lauderdale.
Yes, you will.
Oh, great. And we'll get to spend some time together this time. I kept turning around and you were gone, and I'm going like, okay. So this is great stuff, and I want to thank you very much for taking time out of your busy schedule to do this. We may come back and visit down the road, or we'll see what happens after Lauderdale. Maybe there's things we missed that we need to discuss.
Anytime. That sounds fun.
All right. We'll see you somewhere down the road, and thank you for your time.
Oh, you're welcome. Thank you for having me.